Hello, everybody. Good evening and welcome to BioMonde Live. Thank you very much for joining us. Now, this is a little bit of a different webinar this evening. I don't even know if we can call this one a webinar, can we, Vicky? It's definitely a little different. So what you're joining us for this evening is actually our clinical open forum on larval therapy. So we are essentially turning the table on you guys tonight. And we did ask on social media and over email if you could just come with some questions prepared and obviously just put those to us tonight and we will answer them for you. So we're going to be running the session. We're hoping around about half an hour, depending on how many questions we get, of course. But do feel free to obviously socialise with us. We've got the chat function there, obviously, that you can use. And how you get your questions to us is just via the Q&A button. So if you haven't joined BioMonde Live before, if this is your first time with us, you can actually find the chat button and the Q&A button just down at the bottom of your screen. So do just type into the chat, let us know you're here and that you're enjoying. And as I said, the Q&A button is just for those questions that you've got for us this evening. So I'll do some introductions quickly before we jump into questions. So I'm Rebecca. I'm the UK Marketing and Customer Service Manager for BioMonde. I've been with BioMonde, gosh, for 8 years now, so time definitely flies when you're having fun. But I'm going to be answering some questions for you this evening just around sort of ordering, delivery and things like that. And then Vicky, shall I let you introduce yourself?
Yeah, so I'm Vicky. I'm the clinical support manager for BioMonde, which is, as I always say, just a fancy way of saying nurse. I'm a tissue viability nurse by trade, and I've been with BioMonde for 5 years now. Can you believe it? So I've been using maggots for, well, almost since day one of starting my nursing. So really, happy and confident using, and obviously here to answer your questions around using them, wounds, anything like that you want to talk about, when it comes to larval therapy. So yeah, very excited to see what we've got posed to us this evening.
Brilliant. Yes, me too. It's definitely going to be something fun and interesting for us tonight, I think. And I should say, everybody, don't panic. You can see and hear us tonight, but we can't see and hear you, okay? So our cameras and microphones are on for the duration of this, but obviously yours won't be. So the only way you can get those questions to us tonight is just really by using that Q&A button and just typing them in, okay? So we've prepared some prompts for you all. Sorry if I can get these slides moving along, 2 seconds. So what we've done, just 'cause sometimes it can be difficult to think of questions on the spot. So we've put a few little ideas there for you. So obviously just have a little think around those and any question basically you've got. No question is a silly question, where this is concerned. So do just feel free to ask away. So I can see we've got one question in already from Philippa. Thank you very much, Philippa. She said she's interested in managing hematomas with larvae and how soon can they be applied?
Exciting. Well, I guess this is one for me, really, isn't it?
Definitely, yes.
I have to say, I really love using larvae on hematomas. It's incredibly satisfying to see them work on hematomas because arguably it's one of their favourite snacks. They break down fibrin tissue really, really quickly, much more effectively and much more rapidly, I should say, rather than slough, because it's just the composition. It's just really easy for them for their enzymes to break it down. So I think the question was how soon?
Yeah, how soon can they be applied? So imagine in the treatment, managing and treating hematomas then.
Yeah. So got a bit excited then and went off on a bit without even listening to the question. That's how much I love it. So yeah, what obviously, with a hematoma, we're looking at a wound that has been bleeding. So we do need to take into consideration more often than not, the patient's going to have been on some sort of blood thinning medication, which has caused this or exacerbated it. So we need to look at, are they going to be coming off it? If they're not going to be coming off it, you know, how is that going to affect their bleeding? And we need to look at their bleeding times. And when all of that is sort of safe, and when all we can pretty much guarantee that the bleeding has slowed right down or stopped, that's when you can think about putting your larvae on. Now obviously hematomas normally occur under the skin, so you will often, more often than not anyway, have that sort of skin layer that you might need to address. Either that's going to necrose and you might have to score that or soften that before you put the larvae on. Sometimes kind of the hematoma, it sort of like erupts out of the skin, doesn't it? And if that's the case, if it's like fresh onto the hematoma that you're putting the larvae, you don't need to worry about softening it, because like I say, the tissue's slightly different. It's easier for their enzymes to break down, so you don't even need to score it, anything like that. They will break it down even when it's hard and dry. So yeah, I mean, it's a little bit how long's a piece of string, because it depends how long it's going to take you to, you know, make sure that the clotting factors are fine, find out if they've how like high risk they are of rebleeding, find out, you know, has the wound actually stopped actively bleeding. We have got a couple of trusts that have got hematoma pathways, which include using larvae and obviously looking at when it's safe to use and when it's not safe to use. So if that's something you'd be interested in exploring, then maybe drop us an email afterwards and we can look at, you know, showing you that and seeing if that might be something useful for you. But yeah, a really long story short, larvae can be really good on hematomas and really, really effective.
Definitely. Oh, brilliant. Thank you for answering that one,
That's
Vicky.
okay.
The next question I can see that we've got that's come through is, can larvae be used underneath compression therapy?
Really good question. Yes, they can. So larvae can tolerate up to 40 millimeters of mercury and 4 layers of compression. Now, that is obviously a very time-consuming thing to do, 4 layers of compression. And we still ask that when the larvae are under compression that they have that daily dressing. So it might not be the most practical thing to do, but they can tolerate it. A good alternative, if you don't want to be doing 4 layers of compression every day, is to maybe consider putting your patient or trialing your patient on stockings, because obviously you can roll those down to do daily dressings and roll them back up again. And yeah, some clinicians do like to use that as an opportunity to give it a try. But if you're happy to do your 4 layers of compression, or if it's only 2 layers of compression, reduced compression, whatever, they're absolutely fine with it. One thing I would say though to be careful about is wraps, so like your farrow wraps and things like that. They can be quite, what's the word I'm looking for, occlusive, so it can be harder for the larvae to breathe under them. So I would always err on the side of caution and maybe not use the wraps whilst you're using larvae.
Brilliant. Thank you, Vicky. And just to add, so just quickly before we move on, so Philippa's question from previously,
Oh yeah.
Philippa's just said that she would be interested in a pathway, which is fantastic. So
Fantastic.
yeah,
Yeah.
as Vicky said, we'll sort that out for you after today. So do just drop us an email and obviously we'll get in touch with you then. Okay, so the next question, oh, it's actually a really nice follow-on, Vicky, to the one regarding compression.
Okay.
So what types of secondary dressings can be used in conjunction with larval therapy?
Okay, so the general rule of thumb is the simpler the better. You're wanting to use dressings that are breathable and that remain breathable when they get wet. So for example, you wouldn't want to use something like a super absorbent, because although it might be breathable when it's dry, as soon as they get wet, most of them have got gelling agents in them and that blocks the oxygen flow. So you're looking at really like cotton-based padding, simple gauze, simple bandages. If you can't bandage the area, you're taping around the padding to hold it all in place. If I had to give you brand names, you'd be looking at things like Surgipad, Premier Pad, You can use Zejuvit E, but not Zejuvit Plus. You can use Exupad. But I mean, if you're not sure what you've got on your formulary and you've got to your cupboard and you're thinking, oh, I don't know, you can always drop us a message. You can always give us a ring, and we'll happily, you know, tell you over the phone, yeah, that's fine, or no, you might need to look at getting something else. With your bandages, like I said, they tolerate everything up to compression, so there's not a lot of bandages that you can't use. Things like your zinc paste bandages you're probably going to want to avoid, but other than that, yeah, there's pretty much not many bandages that you can't use. Your dressings that are like film-based, foam-based, silicone-based, obviously you want to be avoiding them. It's just, you just have to remember that the larvae need to breathe, you know, like us. So, you know, if you could probably breathe through it, then hopefully they could breathe through it. But like I say, if you are worried, give us a ring. We'll always happily have a chat with you about it.
Perfect. Thank you, Vicky.
No worries.
The next question, gosh, they are, yeah, they're coming in heaps tonight. So thank you, everybody. Somebody is looking to treat a patient on larval therapy, which is great. But they're wondering, do they need to get written consent from that patient prior to starting the treatment?
Oh, that is a good question. So generally, as long as you've got it, it's because it's a pharmaceutical, I should say, it's treated. The consent is treated the exactly same way. So as long as you are confident and you can document that you have given your patient good information and they've given you verbal consent, that is usually enough. It does very much depend on your trust, though. Some trusts do like to have written consent, but generally, as a rule, most trusts are happy with verbal consent, and as long as you can document somewhere that you've explained everything, and they've had all the information they need to give that informed consent, that's fine. If you need any information about, you know, what's going to happen, what to expect, so that you can deliver that information, you can get our patient information leaflets off the website, or we can send through some hard ones. So yeah, if you need that to help with getting that consent, that's easy enough to do as well.
Oh, lovely. Thank you, Vicky. The next question I can see, I might actually take this one, Vicky, if it's
Go
okay,
for it.
is just how do I prescribe larval
Yeah,
therapy?
go
So
for it.
it depends where you're based. So if you're based in a hospital in an acute setting, it would normally be somebody like a consultant that you go to get that prescription raised. If you're in the community, then it's likely to be a GP, possibly a lead sort of tissue viability nurse in the community, somebody like that. But if you've actually completed your V300 prescribing course yourself, you can raise the prescription yourself. So it does depend, but normally the two routes are, if you're in hospital, then it would be via the consultant who'd sign that off for you. If you're out in the community, then it normally 99% of the time would go through a GP, okay? Let's have a little look. Okay, so the next question, oh, this is an interesting one. Can I use larvae if the patient's wound has got a Pseudomonas infection present? Do you want
Yeah.
to take that one, Vicky?
Yes, you can. You do have to be a little bit careful with really toxic strains of Pseudomonas, and by that I mean when your patient's leg is like bright blue, and it's, you know, that all the clinicians out there will know that really strong malodorous presentation that they come with, you know. That can be a little bit toxic to larvae, but generally what we see happen and what other clinicians have reported to me is that they do a round of larvae. Maybe it doesn't last as long as they would like it to. Maybe it only lasts a couple of days, but then they do another round straight after, and they get the full 4 days out of that, and they get really great results. So occasionally, like I say, with that really strong toxic strain of Pseudomonas, you might have to have one bag that takes a bit of a hit for the team, just to get those results. But otherwise, yeah, normally they'd be absolutely fine. They are bred, or rather they have evolved to live in these toxic environments, so you know, it's no skin off their nose.
Oh, fantastic. Thank you. The next question I can see that we've got through is just asking about the sort of application process, specifically how long does treatment last? How many days is it sort of following application that the larvae need to be in place on a wound?
Yeah, so because it can be confusing because we say 4 days, and some people will get confused as to when day one is and
Yeah.
therefore how long it lasts. So we always say the day of application is day zero. Some people do sometimes think that is day one and then they're losing out on a day of therapy. But your day of application is day zero, and then you have day 1, 2, 3 when you're doing your daily care, and day 4 is when it comes off. It works out roughly 96 hours. You don't have to go down to the hour. It doesn't need to be that precise. But yeah, 96 hours or 4 days, with your day of application being day zero.
Oh, fantastic. Thanks, Vicky. And yeah, everyone, I should say we've got some really great guides on application and everything surrounding that, you know, your daily care. So if you, obviously after the webinar, if you visit our website and if you go to the Learn tab, you will actually find a download center there. And that's got literally all of our literature resources and pamphlets and things like that. So do please check that out.
And I think if
So
I
back
remember
to you.
rightly,
Oh, what was that?
sorry,
Sorry, Vicky.
if I remember rightly, if you go to the section that's called Now,
Mhm.
there's a video of me applying it, if I remember rightly.
I
So you
think
can
there
watch me
is.
do it in real
Yeah.
time. And it like literally takes I timed it and it was like 5 minutes, 27 seconds or something. It was so quick. So yeah, you can watch a live video of me putting it on and seeing it in action.
Oh, it's amazing, isn't it? I think that just shows how much of a nice, simple, easy to follow process it is really with applying
Yeah.
larvae, doesn't it?
Yeah, it's one of those things people build up in their head,
Mm,
especially if they've not done it for a while or they've never done it before, and they worry and they think, oh my goodness, I don't know what I'm doing. And actually, once you've done it, well, once really, you realise actually it's really not rocket science. It's really very, very simple.
definitely. Oh, brilliant. Thank you. Okay, so the next question we've got, oh, yeah, it's another interesting one. God, there are some really good questions tonight, everybody, so thank you. So if they're saying when they receive their delivery of larvae, when they've got it in hand, they said when they picked it up from the pharmacy, how long can they actually keep that product before they need to apply it? Do you want me to take this one, Beck?
Yeah, go for it.
Yeah. So generally, everybody, the rule of thumb, so you've got 48 hours from the point of dispatch from us. So we'd always say you normally would receive your product the next day. So you can either apply the bio bag straight away the day you receive it, or you've got a nice window of another day to get that application done. So we'd always say, you know, there's no need to panic on day one. If you can't get that product applied straight away to the patient, there's no need to worry. You have actually got that nice safety window of another day following the day you receive it to apply. So yeah, general rule of thumb, 2 days to get that product onto your patient. Okay. And then as Vicky said a little moment ago then, so you've got your 2 days of sort of your viability window, and then once that product's in place, you then go on to your 4 day, 5 day, depending on how you look at it, 96 hours of your treatment cycle then, okay? So I hope that's answered your question. But obviously, if there's anything we sort of slightly miss or anything that you need further information on, do just pop us another question into that Q&A button.
Yeah.
Obviously, we are here to answer all of your questions tonight, okay? So next question that's come through, I think this is the same person. Thank you. Is so once they've finished treatment, how do they then go on to dispose of the larvae? Vicky, would you like to take that one?
Do you know what? I hear some really brilliant ways that people dispose of their larvae, and some people do end up feeling quite guilty. But it's really, really, really simple. You don't have to, put boiling water or do anything weird like that. All you do is you take all the dressings and the bio bag, you put it into a yellow dressings bag, tie a knot, and treat it as you would clinical waste. So in an acute area, you've got your orange, tiger stripe, whatever color your clinical waste bags are, put it in there. In the community, it very much depends on how your area looks or sort of addresses clinical waste. So if you have the local council come and pick it up specially, do that. If they ask you just to put it in the patient's bin, do that. However you would treat normal dirty dressings, you treat these the same, and then those little larvae, they go off to heaven having done their good work. So yeah, you don't need to do anything weird and wonderful. They just go into the bin with everything else.
Perfect. Thank you, Vicky. And next question we've got through. Ooh, we get asked this so much, everybody. So when a patient's actually on antibiotics, is it okay for them to have larval therapy at the same time?
Yeah, so I mean, we don't see it very often anymore, but you do have to be careful with topical antibiotics. Anything you're putting directly onto the wound that isn't larvae, you really should be holding off whilst the larvae are in position, because it can block their breathing tubes and things like that. But systemic, oral IV antibiotics, absolutely fine, absolutely fine. Arguably, if it's only a localized wound infection, then as we've said with Pseudomonas, the larvae are pretty happy to tackle that, so you might not necessarily need the antibiotics. Obviously, if it's systemic or your patient's starting to show signs of a systemic infection, you probably want to use your antibiotics. But yeah, it's you could actually end up potentially saving a bit of money and resources, because the larvae are going to address all the infection that's in that wound anyway.
Brilliant. Thank you, Vicky. And the next question I can see that we've got through, offloading. Okay, so sorry, the clinician is asking, before we get too excited, how do they properly ensure that a wound is offloaded? They've said that the patient's got a sort of wound on their ankle. How would they
Okay.
offload that just to ensure that the biobag isn't squashed?
Yeah, and it can be really tricky, especially sort of heels, ankles, places like that. Especially if your patient is used to being quite mobile as well. So I think the first thing you really need to do is sort of manage expectations. And you need to say to your patient, before you even order the larvae, look, if we do this, we are going to have to make sure that they don't get squashed for 4 or 5 days. So you may have to look at wearing different shoes or no shoes if they're all too tight. We might have to get you special footwear. You can get, I think it's called Darko shoes. I'm not sure if there's probably other brands, but where you can take out like the heel, so they're just walking on their toes. It may be, depending on how good someone's mobility is, they're going to have to maybe stay in bed or bed to chair for a few days. So yeah, it's really mainly important to manage those expectations of your patient and what they can and can't do whilst the larvae are there. In bed, obviously, if your patient's lying on their back, you don't want to be putting their heels straight onto the mattress anyway, because of, pressure relieving. But if you've got maggots there as well, double the reason not to do it. So you're going to be needing to look at like your troughs or whatever offloading equipment you've got. What I would be mindful of is a lot of offloading equipment is plastic covered. So if you put it directly over the dressing, potentially that can suffocate your larvae. So it can be a little bit tricky. If you work in podiatry or you have colleagues in podiatry, sometimes they will use their what's it they call it, I want to say foam, but that's not right, felt. They use like the felt that they build up to create like a ring around the dressing, so you can maybe sweet talk them and see if they'll come and help you that way as well. So there's a couple of different things we can try, but yeah, the biggest things obviously, making sure your patient is involved and knows what they can and can't do.
Oh, amazing. Thank you, Vicky. Some really good tips and suggestions there. So I can see we've had a few more people join on. So in case you're wondering what we're doing tonight, so this is our open forum on larval therapy. So basically we are opening the floor to you guys to obviously ask us your questions. And if you're sort of new, you've only just joined on in the last few minutes, how you would get your questions to us is actually just by typing in the Q&A button. So if you've got any question at all on larval therapy, I mean, we've put some prompts up on the screen for you, but you can literally ask us anything you want to. If you just type into the Q&A button, and we will obviously get that question answered for you. Okay, so we've got about 5 minutes on the clock. So yeah, do get those questions to us quickly, guys. Okay. And
But
thank you to everybody that's asked questions this evening. It's been brilliant so far, I gotta say. So thank you very much.
But what I would
So,
say is don't worry, because if you've missed any of the
mm,
questions, we have recorded it. So you will be able to see this recording at a later date. So
yes,
you can go back and
definitely.
watch them.
And a little birdie told me we are hopefully going to be repeating this session as well. So we'll be doing another open forum. I think it's scheduled for the start of July, but do keep
Brilliant.
an eye out because, of course, we will be promoting on social media and via email and things like that. So all the usual channels, okay? Okay, so let's get back to your questions. Okay. So I think this follows on from the question we had earlier, Vicky, just about antibiotic use.
Okay.
Um, the person at home, they've got a patient who is on warfarin at the moment, and they're
Mhm.
wondering, is it safe to apply larval therapy?
Okay, so warfarins are one of our blood thinning medications. Yes and no is the short answer. The long answer is if they are within their normal bleeding therapeutic clotting time, however you want to call it, APTTR, INR, whichever it is you're measuring, as long as they're within their therapeutic range, it is no different to anyone else, and they shouldn't it shouldn't be at a more risk than anyone else. Obviously, depending on which way their bloods have gone, if they are outside of that range, there is a potential that they could bleed. So yeah, you might want to be a little bit more cautious, especially if you've seen bleeding before, and doubly especially if you are worried that the wound is quite close to a big blood vessel or anything like that. I mean, that's true of anyone. If you've got a wound that you think might have a big blood vessel involved and potentially, you know, that necrosis has spread to that blood vessel, remember the little maggots, they don't know they're not allowed to debride that blood vessel, so they crack on, and then you end up with a bleeding you know, artery or whatever it is that's become necrotic. So yeah, it's similar, the sort of same rules apply for any patient, you know, if they're on warfarin and they're in therapeutic range. Be even more cautious if they are out of therapeutic range. Hopefully that makes sense. I felt like I rambled a bit there.
No, no, it's good. I think in situations like that, it's good to cover all bases, isn't it? Because even
Yeah,
though we do say it is a contraindication, if those clotting factors are within the relevant range, then, you've got to use your clinical discretion as well, because
exactly.
hopefully it should be okay. So it's one of those sort of grey areas a little bit,
Yeah.
isn't it? So yeah, got to use some clinical judgment there as well. But of course, everybody, if you have got specific patient cases that you do want to discuss with us, I mean, we're obviously here to do that after
Yeah.
today, of course. So you can email us or give us a call, myself or Vicky. We will be putting some contact details up for you just at the end. So I think we might have time just for one more question. Is that all
Okay.
right, Vicky, if we just squeeze in
Yeah,
one
let's
more
squeeze in one more.
question? Okay, brilliant. So the last one is just about okay. So with the warm weather at the moment,
I know where
is
this is
it
going.
okay to receive and store larvae? Do they need any special storage requirements? Shall I nab this
You can
one?
go for that
Just
one.
the
Yeah.
last one.
Yeah.
So the good news is no, larvae don't need any specific sort of storage requirements. We would say basically just be careful of your extreme heats. So obviously it is getting warmer at the moment. So just be careful, if you're out and about in the community, if you're driving around in to a patient's home and things like that, just watch boiling hot cars and things like that. So the larvae are, to be totally honest with you, most comfortable at just a room temperature. So optimal is anywhere between 5 and 25 degrees. So we'd say the two extremes. So don't refrigerate them. And equally, don't leave them in, extreme heat. So we'd
Yeah.
say in the winter, just keep them away from radiators and things like that. And in the summer, just be careful. Please don't leave them in like direct sunlight or anything like that. That could heat them up too much,
Poor little
essentially.
things,
Okay,
you
so
cook
just a
them.
nice, comfortable, cozy room temperature, and they will be fine. And I would say when you do get them in, so I know you'll be very keen to obviously open them and have a little look, but we would say just keep them in their transit box, in their sort of carton container that they come in, and they come in a little vial as well. So do just keep them in that, obviously, until you've got them with the patient and you're actually ready to apply them, okay? Okay, so thank you everybody.
Ah,
Let me just double check just before we close. I think, yeah, I think we've answered all the questions. So thank you
ah.
everybody. Just squeezed the last one in there, so that was brilliant. Thank you guys. But yeah, if you have got any questions, obviously after today, do please reach out to us. I will put our contact details up. I'm not used to hosting. Vicky normally hosts the slides, so this is new for me.
You scammers.
Right. So yes, here's our contact details. So if you do have any questions after today, this is basically how you would reach us. So the clinical helpline is manned 24/7, although we might not answer at like 2 o'clock in the morning. But yeah, do just give us
Leave
a
a
ring
message.
anytime you've got any questions. And if talking isn't your thing, don't worry, we totally get it. You can always email us instead. We've got a clinical help desk email, clinicalsupport@biomonde.com. And if you visit our website, you'll also find a contact us form that you can submit instead, okay? And we are on social media as well. So we're basically on every social media platform you can imagine. The only one missing from here is TikTok, but we're on TikTok as well. So yeah, down with the kids, as we like to say. So yeah, please do check those out. And I think that is it. So yeah, just thank you everybody. We've had some really, really good questions through tonight. It's been nice to engage with you all, and I hope you found it useful. And thank you, Vicky. I know you've answered the majority of questions this evening, so yeah, it's been a good one.
It's great to have this space because when we do our webinars, we don't always have a great deal of time at the end to answer questions.
No.
We have had the odd webinar where we've had to cut them short, so it's nice to just be able to give you that space to ask us whatever.
Yeah, definitely to open the floor to all of you lot with all of your questions. So it's lovely. Thank you so much for your interest. We really do appreciate it. And we do have some more webinars obviously coming up. So they're all listed on our website. And of course, we will be promoting them via socials and email as well. So do just keep an eye out for those. But yes, thank you, everybody. It's been a pleasure. And we'll let you enjoy the rest of your evenings. Thank you very much.
See you soon.